Hi, my name's Angelica,
And my name is Tatiana.
and we're going to talk about the therapeutic use of exercise.
Okay, so we have to start with introduction to therapeutic use of exercise. So it has been proven that exercise promotes muscular strength, endurance, flexibility, optimal body composition, cardiovascular functioning, mental health, cognition, and just healthy life activity in general. Some of the benefits of being active involves improved mood and self-esteem states, decreased anxiety, depression, neuroticism, and stress. So, exercise, the definition is it's a type of physical activity that involves a deliberate, planned, and repetitive bodily movement done to improve or maintain one or more components of physical fitness. Exercise can further be classified in aerobic and anaerobic. In anaerobic exercise, the activities can be performed without oxygen, meaning you're not running out of breath when you're doing it. While with aerobic exercise, the activities are requiring more oxygen, so it pushes you to the limit, requiring the body to increase its capacity. So it could be like a cardio session. So now that we're done with the introduction and definition, Angie's gonna go ahead and talk to us about history and description and the purpose of therapeutic use of exercise.
Okay, so the purpose of therapeutic use of exercise is for TR specialists to use this facilitation technique to improve ambulation, joint mobility, coordination, circulation, relaxation, balance, strength, endurance, body composition, and respiratory capacity. That's the purpose. The history for this technique starts with the concept of physical activity. Physical activity and fitness is not new. Early records indicate that organized exercise was used for health promotion in China around 2500 BC. Early philosophers like Hippocrates and Plato believed in the importance of physical active lifestyle in order to promote well-being and usefulness in treating disease. In ancient societies, it was necessary for people to be physically active for survival. People were required to run from danger, hunt for food, and physically carry anything they need to use. Nowadays, humans have become successful at avoiding physical activity, which is now a major threat to the health of members of our society. The description for this technique is the goal of using exercise as a therapeutic medium in order to increase the total time a participant engages in physical activity over the course of their daily life. Now we're going to go over theoretical foundations of therapeutic use of exercise.
Okay, so in the book we found the theoretical foundations for the therapeutic use of exercise are the health belief model, the theory of reason action, theory of planned behavior, the trans-theoretical model, and self-determination theory. In the health belief model, it discusses on how an individual's beliefs about the susceptibility and severity of illness combine to create an overall perceived threat of illness. So what we do as specialists is educate the individuals with disabilities on the benefits of exercises prior to their involvement in the program. So in other words, for the participants to know about the benefit of exercises, so that way they will be encouraged to be engaged, because not everybody wants to just like start exercising, but if you tell them that it's going to be good for them, then obviously people will be more likely to engage in certain stuff. So for the next one, in the theory of reason action, discusses how the intentions of an individual are influenced by positive or negative attitudes regarding behavior and perceived norms. So as therapists, we should consider how the influences outside are influencing our patients in order to get them engaged in exercise. So if people feel good about a behavior and have positive social influence, meaning everybody's around them, it's giving them good feedback about it, they will be more likely to intend to perform the behavior, in this case the exercise. The third one is the theory of planned behavior, and it discusses on the importance of controlled attitudes and social expectations on intentions to participate in moderate to vigorous physical activity. Again, us as therapists will be more successful in maintaining the participant's involvement if the participant is given control within the program. So this just basically says we have to try to get the person to tell us what their interests are and like what kind of exercise they would like to perform, so that way they could be more engaged. And again, the goal is to like make the person stick to the program. So if you get them interest, of course they're gonna want to continue exercise.
Okay, so the fourth one is transtheoretical model, which talks about the moves for participants from what they go through from the stages of no intention to change through stages, leading to change being part of the individual's life. So basically is the different stages the participant goes through before considering to engage and stay in the program. So the final and fifth one is self-determination theory, which talks about the type and quality of motivation that is important in predicting behavior in general. TR specialists developing a plan should consider 3 basic needs for self-determination, which are autonomy, competence, and relatedness. So basically, if the plan meets the 3 basic needs, the motivation of the participant will increase and become stronger, and adherence to the program will be more likely.
And now we're going to talk about the explanation of the effectiveness of the therapeutic use of exercise. So the effectiveness of the intervention of therapeutic use of exercise is associated with physical health, mental health, health quality of life, and cognition. We chose 3 studies to prove this. We chose, out of the range of population, we chose obesity, Parkinson's disease, and bone health. So for the obesity experiment, the obesity population participants were investigated by Knopfler and colleagues in 2008 on the effects of an 8-week program that involved 130 children and adults. The program targeted calorie restrictions, physical activity and behavior modification, and the outcome showed a decrease in both body weight and body fat percentage, and an increase in quality of life and aerobic fitness. Then in the Parkinson's disease one, the population participants were investigated by Menji and colleagues in 2013 on a 4-week exercise program about activities of a daily living 2 times per week, 30-minute sessions. The program evaluated the range of motion, balance, coordination, stretching, strengthening, and gait exercises for all those people. And the outcome showed an improvement in the Parkinson's disease rating scale part 1, and reflecting positive changes in activities of daily living after the completion of
and the last one would be bone health. The population was investigated by Louis Ambrose and colleagues in 2005 on the effects of exercise program on risk of falls in 98-year-olds women with low bone mass. The program evaluated resistance, agility training, and stretching of 3 randomly assigned groups. The outcome showed that after 1 year, all 3 randomly assigned exercise groups showed a lower risk of fall, a lower fall risk.
Hey guys, so for this other part of the video and adapting the activity, we decided to move locations and we're outside of a gym. For the purpose of the activity, we thought it would be better to use gym equipment. However, you can also do the exercises that we came up with at another location, like a house. But for the purpose of the better equipment and the resources, we decided to move to a gym. So Angie's gonna talk to us about the adaptations and how to lead the activity, and then we're gonna go inside and show you guys how to do the exercises normally and how to adapt the exercises for somebody with the injury we chose.
Alright, so we chose spinal cord injury, and our activity is muscle strengthening, right? Muscle strengthening. So some adaptations we came up with is depending whether it's complete or incomplete spinal cord injury. If the patient has balance problems, we can sit them down in a chair or in their wheelchair and utilize a chest strap. This to avoid any risk of falling. Then, if the patient has problems with balance, the activity will be adapted so they can use one arm or one leg at a time. And if a patient cannot perform arm exercises standing up, then they may sit in a chair in order to complete the activity. And if the patient has skin problems, we should consider the type of materials that are going to be used for the activity. Now for the leading, in order to avoid high blood pressure, make sure the patient goes to the bathroom when needed during the activity. Control the activity, making sure the patient is not hurting him or herself when lifting the weights. And if the patient has a lot of spasticity, provide some warm-up exercises first and supervise them closely during the activity. And monitor the patient's heart rate just in case, because some people use a sensor in order to monitor it, so that's a good way to do the heart rate.
Or you can do a talking test, which is when the patient is exercising,
and if they can talk normally,
then you know you're not pushing them
too hard. Yeah. Okay, so now Tati is gonna explain to us kind of like all the exercises that we will probably show in there. Not all of them, but some of them. So she's gonna talk about it.
Okay, so like we said, the injury is a spinal cord injury and it's a muscle strengthening activity. So for the activity, we always recommend to start with a warm-up. We're not gonna perform that because it's specifically for strength training, but the patient should always try to warm up a little bit just to get the muscles, and the blood flowing.
Mm-hmm.
So we chose a 25 to 30-minute routine for 3 days a week for patients that just have started. However, as the patient progresses, then you could always move the activity to 30 to 60 minutes a week for 3 to 5 days, depending on how the patient is feeling and how the progress is going. We also chose to do 2 sets out of each exercise for 5 to 8 repetitions each, again, because we're saying, as if the patient has never been involved in a program, you don't want to overwork the patient on the first week or so, on the first days of training.
Mm-hmm.
So the exercise that we've chosen is an overhead shoulder press with a medicine ball. That's one of them. The objective for that one is it will help the patient with lifting objects overhead. As you know that you have a spinal cord injury, you will be going like this. It will be a lot easier to help you with that, and also assist in pressure releases and help with balance in a wheelchair. We have another one which is called the lateral pull down, and the objective is to help with transfers and lifting up for the pressure reliefs. All of this is just going to help you move your back a little bit better and help with balance and strengthening of your back. The chest press with a cable machine or free weights, that's an adaptation. You could do the exercise in a cable, but if it's too much weight for the patient, then you can use free weights and do it with that. And again, the objective of that is to help with pushing a wheelchair and assist with pressure reliefs. We also have the pulley rows, and the objective is to help improve posture and prevent shoulder injuries and also help with stabilization. And lastly, we chose a pulley internal and external rotation, and this one could also be adapted with free weights. Again, if it's too much weight for the patient, then you can also use free weights, and the objective is that these help with stabilizing the shoulders and are important in preventing instability and other injuries that the patient may have. Angie is going to show us how to do a lateral pull down for somebody that has no problems with posture. So Angie, you can go ahead. And as you can see, she's just sitting on a chair and she has no other type of help.
Here is without adaptation, the pulley internal and external rotation. That is what she is demonstrating. Tati is gonna use it's supposed to be a sandal bar, and it's the overhead shoulder. Yeah. You see, she's using that without adaptation.
And she's gonna show us the adaptive part of the sandal. She's gonna do 5 repetitions for us. That was 1, 2, 3, 4, and 5. It's important to see that Angie has support for her back right here. She has a chair, and after Angie's done, you can put it down. And it's important to give her like a minute or a minute and a half of rest. You don't want to overwork the patient.
So here, Tati's gonna demonstrate the lateral pull down adaptation. Each girl. She's gonna do 5 reps. That was 1. That was 2. That was 3. You see how the bunch supports her back? That was 4. And that's 5. Now, normally you can, for the adaptation, she'll take 30-second rest and then she'll do it again.
Angie's gonna show us the adaptation for the pulley internal and external rotation. Go ahead, Angie. She's gonna do 5 reps on one arm. 1, 2, 3, 4, and 5. You can go ahead and put it down. Rest. We're gonna pretend this was 30 seconds to a minute rest, and then you can begin in the other arm. 1, 2, 3, 4, and 5. Thank you, Angie.
We hope you guys liked our video. Thank you for watching. We hope you learned about the therapeutic use of exercise from us with our video, and we hope you learned how to adapt this activity. Also, keep in mind that with spinal cord injuries, patients may have a mild to severe level of injury. So you would have to adapt the activity according to the condition of your patient, of what works with them.
So by adapting, we mean keep in mind that talk test that we talked about earlier. Make sure the patient's not overworking themselves. Allow enough time for the patient to rest. And watch out for the weight. You know, we use machines and you can vary the weight. If it's too much weight for the patient, then grab a dumbbell or try to change the exercise, you know, whatever fits the patient the best. It's all for the good of the patient and for them to reach their goals. So thank you guys.